In this lecture, we will explore lifestyle medicine interventions, core competencies, and disease management, focusing on how evidence-based lifestyle approaches address the root causes of chronic disease. You will expand your understanding of lifestyle medicine and the powerful impact of lifestyle choices on long-term health. We will master the 6 pillars of lifestyle medicine: physical activity, sleep, stress management, substance avoidance, and social connections, and learn practical clinical tools supported by real-world case studies. The lecture will clarify the differences between disease control, reversal, and cure, build core competencies such as leadership, assessment, and management, introduce intensive therapeutic lifestyle change programs, and equip you to foster sustainable, healthy behaviors in patients for long-term well-being. Do you know that 80% of primary care visits are related to lifestyle-related diseases such as obesity, metabolic syndrome, hypertension, cardiovascular diseases, dyslipidemia, arthritis, diabetes, and osteoporosis? Let's explore the global figures on the leading causes of death in 2019. As you can see, in 2019, ischemic heart disease, stroke, chronic obstructive pulmonary disease, cancers, and diabetes were among the top causes of death, many of which are linked to lifestyle choices. It's striking to note that 80% of premature deaths are attributed to just 3 factors: tobacco use, or diet, and lack of physical activity, all lifestyle related. Research shows that only 3% of people practice the 4 major health behaviors: non-smoking, maintaining a healthy weight, eating 5 servings of fruits and vegetables daily, and regular physical activity. Even after being diagnosed with chronic conditions, unhealthy habits persist. Only 11% of diabetic patients follow dietary guidelines for saturated fat, and 8% of heart disease patients continue to smoke. Incorporating lifestyle medicine into patient care is vital for physicians and healthcare professionals, as it plays a key role in preventing and reversing chronic health conditions. Let's go through the definition of lifestyle medicine. American College of Lifestyle Medicine defines lifestyle medicine as a medical specialty that uses therapeutic lifestyle interventions as a primary modality to treat chronic conditions including but not limited to cardiovascular diseases, type 2 diabetes, and obesity. Lifestyle medicine certified clinicians are trained to apply evidence-based, whole-person, prescriptive lifestyle change to treat and, when used intensively, often reverse such conditions. Utilizing the 6 pillars of lifestyle medicine, emphasizing the whole food predominant diet, engaging in physical activity, ensuring restorative sleep, managing stress, avoiding harmful substances, and fostering positive social connections prove highly effective in preventing various health conditions. A whole food, plant-based dietary approach predominantly features plant foods like whole grains, vegetables, fruits, beans, and legumes with minimal or no inclusion of animal products such as dairy, meat, or eggs. Lifestyle medicine has the potential to impact healthcare by diminishing dependence on medications significantly and minimizing associated medication side effects. Let's see a few successful stories in lifestyle medicine. Following are some successful stories in lifestyle medicine. More studies will be discussed later in this course in details. A study conducted by Sarati and colleagues on Asian youth newly diagnosed with diabetes showed that intensive lifestyle therapy, either alone or in combination with metformin, could lead to reversal or partial remission within just 3 months. Moreover, this positive outcome was sustained for 2 years thereafter. Diabetes prevention programs as lifestyle changes were almost twice as effective as metformin. Studies found that exercise was 26% more effective than percutaneous transluminal coronary angioplasty in coronary artery disease patients. Portfolio diet offered equal cholesterol control with lifestyle changes when compared with low-dose statins. In this course, we will delve into various studies and research findings in greater detail as we progress. This will provide a comprehensive understanding of the subject matter and help integrate evidence-based practices into your clinical approach. What is meant by disease reversal, cure, and control? Disease reversal is achieved when all laboratory markers or diagnostic tests for a particular condition fall within the normal range with no current medication use and no observable signs or symptoms of the disease. However, some argue that true disease reversal or cures are attainable mainly in acute infectious diseases. In contrast, others contend that long-term remission like successful cancer treatment or resolving diabetes through bariatric surgery or intensive lifestyle changes can also be deemed a cure. On the other hand, controlling a chronic disease denotes improvement in laboratory markers and diagnostic testing to accepted standard levels, even if complete normalization is not achieved. Intensive Therapeutic Lifestyle Change or ITLC programs. Intensive Therapeutic Lifestyle Change or ITLC programs are evidence-based and used in lifestyle medicine to prevent or reverse chronic disease conditions by drastically changing someone's daily routine, sleep habits, eating patterns, physical activities, and stress management. Multimodality teams, including the provider, pharmacist, registered dietitian, certified health coach, condition management nurse, or physical therapist involved in ITLC programs. The Pritikin Program, Ornish Program, and the DEAL CHIP or Complete Health Improvement Project Program are the most popular ITLC programs. In this course, we will delve into various ITLC programs and research findings in greater detail as we progress. What are the lifestyle medicine core competencies that should be mastered by every lifestyle medical practitioner? The National Consensus Panel has identified key core competencies and every lifestyle medicine practitioner should master. These competencies include leadership, in-depth knowledge, assessment skills, management abilities, and support in book office and community settings. Leadership. Leadership skills are crucial for guiding teams and fostering positive change in healthcare practices. The provider acts as both a medical expert and a coach. Leaders should promote healthy behaviors as foundational to medical care and disease prevention. Also, they should create environments that support healthy behaviors. Knowledge. A solid foundation of knowledge ensures that healthcare professionals stay abreast of the latest developments and evidence-based practices. Physicians should know the evidence that specific lifestyle changes can have on patients' health outcomes, such as the effect of smoking cessation on lung cancers, COPD, and cardiovascular diseases, the effect of exercise on prevention and treatment of breast cancers, the effects of a plant-based dietary pattern in reducing blood pressure, lowering lipids, and prostate cancer regression. More evidence regarding lifestyle medicine practices will be discussed later in this course in detail. Assessment skills. Assessment skills are vital for accurately diagnosing and evaluating patient needs. Physicians need to assess the social, psychological, and biological predispositions of patients' behaviors, as well as assess patients' and families' readiness, willingness, and ability to make health behavior changes. Management skills. The healthcare team should use nationally recognized practice guidelines to assist patients in self-managing their health behaviors and lifestyles. Office and community support. Physicians should practice in an interdisciplinary team of healthcare providers and support a team approach. Physicians have to use appropriate community referral resources that support the implementation of healthy lifestyles. In the upcoming lectures, you will master these core competencies and explore them in detail through the lens of the pillars of lifestyle medicine. Thank you for your commitment to advancing your knowledge in lifestyle medicine. I wish you the best of luck as you continue with this course.